Hi, YouTubers. Today is April 21st, 2020, and we're talking about coronavirus and the end of medicine as we know it, question mark. So, currently, most doctors and medical personnel work outside of hospitals. Even hospitals currently, during this pandemic, are basically shut down except for acute care. In other words, they're not doing elective surgery, they're not bringing in people for non essential reasons. Uh, and so, even hospitals right now are uh, financially strapped in a way because they're not actually fully open. Uh, Intensive care, the emergency room, the acute hospital medical wards are only a portion of what actually goes on in a hospital. So, right now, prior to the onset of the pandemic, many private practices and clinics have been in a very precarious financial state. I mean, they are at the mercy of what insurance companies agree to compensate for services, the rules and regulations from both the government and the insurance companies are very complex, creating the necessity for a lot of administration, which functions or results in decreasing the efficiency of the practice. In other words, it costs more and more overhead to be able to stay open in order to provide the medical services to your patients. So the profit margin is very, very small, and it won't take a whole lot to topple the financial stability of a practice. So now, during this pandemic, uh, either the practices have shut down, the ones outside the hospital, and even the ones in the hospital that are not providing primarily emergency room, urgent care, that kind of stuff, or they're doing very, very few visits, and they're doing telemedicine instead, which is fine, except that the caseload, including both the people who actually visit physically the medical practice and those who are using telemedicine, the total visits are way down. So, what's happening? Well, the practices are scrambling like the rest of the businesses that have been totally shut down. These practices are scrambling. They're laying off their nurses, their doctors, their receptionists, their billing personnel because they're just not needed, and or they're applying for the loans that the government is giving to businesses to help keep them afloat during this time. But a lot of these loans, some of them are forgivable, some of them are not. Now imagine you have this medical practice, and the government says, uh, you know, we'll give you X amount of money to keep your practice afloat for the next few months, but eventually you're going to have to pay this back. And now you go out of business because it's gone long enough to the extent that you just can't make it work. So now you're not only out of business, but you've incurred this huge debt to maintain the business afloat with the anticipation that eventually you will be able to uh, start up again after the pandemic is over. So you're in deep, you know what. And so what's going to happen? So the medical practices that get caught in this situation, they're going to have a choice because the choices aren't going to be good. One, because if they can't continue and be financially viable, then they will either have to sell out to the hospitals who that may or may not be in a position to purchase them because they're going to be hurting financially, or not local, but large medical conglomerates that already control huge portions of the medical market, and they will buy up these medical practices because they're going to be at bargain basement prices, um, and or the practices are just going to have to say, we can't make it work. There's nobody to buy us out. We have to just shut down. So then what happens? Well, if they shut down, and if they shut down in quantitatively large numbers, then they're not going to be there anymore. It'll be a thing of the past. You'll read about it in the history books. Now, when you need a doctor, you'll go to the hospital, or you'll go to another large conglomerate. It'll be like, think of an example, like we have AT&T and Verizon and Sprint. You have a few large carriers for cell service, and that's pretty much, when you need cell service, that's pretty much the market. You got a few scatterings of some others there, but they're not quantitatively significant. I expect the same thing's going to happen with medical care delivery. Your local private medical doctor running his own clinic, being able to give you a more personalized service, say goodbye. It's not going to be there. So this is what I see happening, and I think it will happen very quickly because the infrastructure of the country can only handle so much. The government can only give so many of these multi-billion-dollar, trillion-dollar bills to pass to keep things going. We're going to try to restart the economy safely, slowly, but in the meantime, all this is happening like other businesses. It's not just medicine, but medicine I think is interesting because it's a paradox. Here it is, during the course of a medical emergency of global proportions, which may last years, the thought that the providers of medical care are being their jobs are being lost because of this. It just sounds strange. Now, things will shift around. Other openings will become available, and the workforce will reshuffle, and things will eventually restabilize. But things are going to look very, very different when this is all over. So I hope you found this speculation interesting, and stay safe out there. Thanks.